I'm kidding.
Hello and welcome to Dateline New Haven. I'm your host, Paul Bass, inviting you to look behind the headlines on the stories that make our community tick. Maritza makes New Haven tick. She's the city government health director. When she started 6 years ago almost, she was in the headlines a lot because we had the COVID crisis and all sorts of controversies. And now she's settled in long term, a lot happening with the health department that might not always make daily headlines, but matter very much to the health of our community. So Maritza's come up for an assessment check, a health check.
I love it.
A check-in.
I love it.
Okay. Did you have your insurance card at the front desk?
I do.
Okay.
I'm fully insured.
Okay. Just make sure we get reimbursed. Okay. Maritza, welcome back to the
Thank you.
WDAs. Thank you so much for coming in.
It's such a pleasure to be back. I was just saying, I think it's been 2 years since we've formally sat down, although I've seen you in passing.
Yeah.
So it's great to be back.
So you're really settling into this job. I mean, 6 years now it's coming up on
almost 6 years. You know, I was raised in New Haven, and so New Haven is a special place for me. And the fact that it's already going to be 6 years is amazing. And to be doing other things than responding to a pandemic, it's really good to be part of the community and supporting efforts that are happening on the ground.
And I was looking up at stuff you've been doing. You've been busy. Again, it's not the stuff that's controversial, but it's interesting.
Thank you.
And one of the big things you got going on right now is you're trying to get everyone you can in New Haven, and I did it yesterday, by the way, to go online and take a survey just about the status of health, a health assessment survey, community health assessment.
Yep.
So what is that? How'd that come about, and why are you doing this?
You know, it's important for us. Thank you. It was important for us as we are sort of revamping and looking at our strategic priorities for the next 5 years, that the community's input is part of that process. And so we are conducting a community health assessment, which is slightly different than the community health needs assessment that the hospitals have every 3 years. This one is specifically on the grounds. What are some of the challenges that you're facing as a community? And then what are some ways that the health department can either respond directly or be able to demonstrate that we're linking people to that care?
You know, it's interesting when government works day to day. Sometimes it's hard to stop and say, well, where are we?
Yeah.
When government can be so crisis respondent, you know?
Reactive.
So it sounds like, if I'm not mistaken, you're trying to find out where we are.
Yeah, and get a pulse.
Taking our pulse.
Right.
So so I noticed when I took it, the survey, first it kind of asks you who you are and how you're feeling about your life and how you're feeling about your community. And then it dives into what do people specifically need. And you even talked about food, housing, and healthcare and that kind of stuff and how they're feeling trust. What are you learning so far? It's like, when did this start?
So, you know, I'm looking forward to the results. They're still doing focus groups around the community, as well as doing the surveys that individuals get. We just concluded, I think, the last focus group, and now we're focused on the survey. And it's going to be great to see this qualitative report, both quantitative and qualitative report that will come out. And once that gets produced, we will then do an assessment of like, where are we? How are we going to prioritize it? What partners need to be part of this conversation in regards to that linkage to care if we're not providing it directly, or an interdepartment that may offer services that we want to make sure that we're measuring these outcomes not just holistically, but looking at it quantitatively.
And who's doing the focus groups?
So we have our organization, a vendor called Intium, and they're helping us. We wanted to have an independent consulting group that's supporting and making sure that it's neutral, and so that it's not top-down government-led, but is really led by an independent consultant that can then gather this information for us.
So what kind of focus groups they did? What
community conversations that pretty much is this exact survey, but it's just live in person. And now individuals can participate. And also there's a incentive. We want to make sure that we value people's time. $25 is a lot. Listen, you can probably buy a turkey with that if you celebrate, or a meal. But we are trying to do gift cards to respect people's time. But we really want to encourage the community to go on our website and click on that link.
And when did it start and when does it end?
It started about a month and a half ago. And so it's we're concluding. We're in the last few weeks of the survey. And so hoping that we can get that last push.
Have you heard anything anecdotally from the focus groups or from your own work around town? What seem to be the big public health concerns in New Haven right now? How are we doing as a healthy or not healthy city?
Yeah, that's a really good question. And there's always public health emerging issues nationally, statewide, and locally. And I think for us, we have to just name the issue that's been happening in our city, and it's the smoke shops and the tobacco realtors that have been a nuisance in our cities. Some of them are good players, and then there's a few that are not, right? And
Well,
so
basically everything's a smoke shop now. We were in West Haven last night.
essentially,
We see pharmacy and basically smoke shop
it's
and
essentially a
grocery and smoke
statewide
shop.
issue. Actually, it's a countrywide
Yeah.
issue. I was in New York City visiting family, and it's like every other store is a is literally a smoke shop.
And
And
you go
so,
any kind you're on the road, any kind of gas station, and a
yeah.
smoke shop. They're also selling weed. Like
Well,
basically everybody
unfortunately,
seems to
there's some
buy their
bad
weed.
players.
But
Um,
most places, right?
Well, hopefully not. I mean, we are cracking down, and so we created we were fortunate to have alders who created this work group that was comprised of interdepartments. Health was at the table, and now we require licensing, and that really allows us the opportunity to inspect, and also respond to complaints that come in
And
from
what
the
are you looking
community.
for?
We're specifically looking for adherence to federal and state laws, making sure that they're not selling to minors and not marketing. There are some restrictions in regards to marketing, and making sure that they're not targeting the youth. And
So
so
you're not looking for cannabis. You're
we
talking about
we
tobacco.
will we are looking for anything that is not. If we witness that they're selling anything other than what they're supposed to be selling, we do report that, and we collaborate with public safety. We immediately notify the state in regards to those violations, because that's an illegal dispensary, right? So there's a dispensary licensing process
And the reason we care about that partly is safety, right? Because
because
the nitizine's coming from China and the stuff that gets fentanyl that gets in the weed that you get
exactly
if it's
you
not minor
have
metals.
a significant concern in regards to what's being produced, how it's being produced, what's being put in the product that can end up a fatal circumstance, especially if there's a young child or an adult that think they're purchasing regular marijuana but may not realize it's laced with fentanyl or other chemicals alike.
So why is there any other reason that we have so many smoke shops besides the fact that they become under the table
It's
cannabis?
unfortunate.
No, but is there another reason smoke shops are everywhere?
I mean, I think that's one of the main reasons. I mean, it's become a phenomenon because it's like, well, we're not going to go through this restrictive licensing route. We're gonna follow our own routes, and then you have drug dealers using it as a storefront. And I don't, I take people's lives seriously. The quality of someone's life is very important for us as the health department, and so the fact that we can license, and as an agent of the state, I have the ability to do so. We want to enforce that and making sure that people are compliant and not creating a greater risk in the community.
Can so many of these stay in business if they're not selling weed?
No, they cannot. So there's a whole tier system with us. Three
I just
strikes
mean like
and you're out.
I just meant economically.
I mean, economically, could you
'Cause all
just
of a
imagine
sudden
they're
there are a
making
million
a
of
lot
these
of money?
shops.
I mean,
But are they making money on stuff other than weed for real?
I mean, they're selling illegal products, right? And so the daily, what we've been finding when we do these sweeps, have been significant amount of products, and so we know that they were just getting in trouble and then reopening really quickly when a local
And
license was not
this
available.
isn't about pressing you. This is a national issue, as
It's
you
a
mentioned.
national
So I'm trying to
issue.
look at it as a business level. We see a million of these shops pop up.
Hmm.
Is it possible for them to make money if they're not illegally selling weed?
Well, that's a good question for a tobacco realtor, right? So they're selling other products too. Some of them it's a deli, like you mentioned, right? So there's a gas
Right
station.
on
So
State
there's
Street, the New Delhi, like everything's a smoke shop. It's
yeah.
hilarious.
So it's like they're selling other products, and they're staying open. So they're evidently in business and selling their products of what they're licensed to do. And the target is really targeting individuals that are not doing that, and that's what's important.
So what are you finding so far? What works and what doesn't when you deal with this
What
issue?
we've been finding is products that are fake Doritos, candy that simulates Skittles. So it's been interesting.
And what's in those?
THC laced products, and
And that stuff's so concentrated. That's how the kids get sick.
And also, yeah, the milligrams are significantly higher and then the dosage amount. And so we've been sort of, we just had a statewide meeting on where public safety and local health was invited to a conversation, and we were even displaying some of the things that we've been finding, and it's sad to see how they're marketing and even some establishments naming themselves names that I'm not going to, start naming right now because I'm definitely not going to promote these businesses. But we know if you live in the neighborhood, you know what they are. And so it's been this push and pull. But I am happy to report that there is some 100% compliance. There are some players that are in first violations or second violations with the health department, but for the most part, they are complying with the licensing regulations in the city.
So interesting to be a local health director on a challenge that the entire country is dealing with, or at least blue states for the most part, right?
Right.
And red states that have and I heard one law enforcement say, well, what they think when they legalized recreational cannabis that we weren't going to have this because people were, you interview people, I read, they say it's just cheaper. I go to my neighbor place, they're willing to take the risk that it's not, regulated by the government and safer, but it's cheaper, they get higher.
Right. Right. And it's important that people understand that it's not being monitored. The milligrams are significantly higher, and it does cause a risk factor to a potential overdose and untimely fatality, and that's what we're trying to avoid. And we also have a whole campaign around ending stigma because we know substance use is real, and people are struggling already, and the fact that you have bad players doing that is disheartening.
And we're talking to Maritza Bond, the health director, finishing up her 6th year with plans for how the new phase coming up. We're going to talk about it. Before we get rid of this, leave this issue. So we talked about cannabis. That's one thing. But there is substance abuse, which is a huge issue in every city, not just city, right? Rural in America. How are we doing with overdoses, fentanyl, substance abuse?
Yeah, so we've actually, and I want to shout out all of the harm reduction organizations and all the collaborators in their efforts on reducing fatalities, because we have seen a decline in the last 3 years. Unfortunately, as a county, because the partnership that we currently have is a New Haven County effort, the grant that we received from CDC, we still saw 278 lives lost just last year.
In the county, not the city.
In the county. And so that is still
was
significant.
that down from an old number?
And so locally, what we've been doing is sort of looking at the progression. And it's been, it depends on the community, obviously. But what we want to do, one of the things that we did is we did focus groups. We also know that data tells us that one of the things that discourages individuals from getting care is because of the stigma that exists. In fact, only one of five individuals are getting the care that they need that are dealing with substance use. And unfortunately, CDC also reported that 75% of the community do not believe that substance use is a chronic illness. And so we, at that point, realized we need to do a campaign to educate the community, because it takes really all of us to be able to ensure that we're supporting individuals who are struggling, because we know that when someone finally makes it to that front door at a healthcare facility, it took a lot for them to get there.
And you said the 1 in 5 is that New Haven number or nationally?
It's nationally.
Not getting the Kennedy. Is that true around here too? Or we don't know?
And it's true. When we did focus groups here in the community, before the campaign launched, it was consistent with the national data that we see.
And when did you launch this campaign?
And we just launched the campaign about a month and a half ago. And
what's it called?
It started with, and it's an endstigmact.com website that we've actually incorporated, which has toolkits for media people like yourself, traditional media and social media campaign on how we can reframe the messaging. We also have one for healthcare professionals that work in the healthcare field who encounter individuals. We have faith leaders toolkit. We have a toolkit for public safety. So different audiences, we created customized toolkits so that we can make sure that we are not imposing judgment, because our words really do have power. And they say, right? People say what we speak is life or death when we use our mouth to speak.
And is that a New Haven campaign or a statewide campaign?
This one is a county campaign.
So it's you and other health directors?
21 towns in total. And so I'm very I'm full of gratitude with my peers that cover these other towns, working in collaboration, and we also have navigators on the grounds doing outreach, covering these towns as well, so that we can link people to the care that they need.
So as I understand it from what you just said, 1 out of 5 people who seek care for substance abuse problems don't get in the front door to get the care they need.
Mm-hmm.
And that this End Stigma campaign, am I correct that we're focusing on that 1 out of 5, the people who
Mm-hmm.
want the help, make sure they get it, and they
Mm-hmm.
don't feel stigmatized?
That's right.
Because until people want, I mean, at least we all know anecdotally in our lives, people we know, when they're not ready for the help or they don't want it, you really can't help them, can you?
We can, and there's prevention, right? And I think that's why
No, I mean, if someoone's in the throes of substance abuse and they're not at the point where they hit bottom, they
you
really
have
just
to
wanna get
support
high.
them where they're at, right? And so
So
we
how do
want
you
to meet
support
them.
them when they don't want to kick it?
So making sure, so we have Rover kits throughout the community to help them. Rover kits, and those are providing them, and even at the APNH organization where they have and I think you've covered this story in the past, where we have a vending machine with supplies to help reduce number one, overdoses, the
From shared needles and things.
shared needles, but we like to make sure we get those needles back for those organizations that are doing that effort. We work very closely with local organizations that do dispense those needles to ensure that they're also getting them back, because we don't want a public health nuisance of an abundance of needles that then becomes a problem
I mean,
in
if
the
someone else
neighborhoods.
reuses them.
Right. So
Or
if you're
kids pick 'em up.
dispensing them, make sure you're
So I
collecting
guess
them.
I'm wrong. So the 1 of 5, you want to get the 1 of 5 who come to the door, make sure they get the help, and then for the other 4 to 5 who are in danger, you want to make sure try to save some lives.
That's right.
And I guess one of the big issues nationally is whether to have safe injection zones. You're saying while they're using, find a place where they can come safely, that's out of the way of bothering other people, where they're not in trouble, and you can have people around to offer them help if they're ready for it. We want to do that in New Haven. That got shut down, right?
Well, yeah, that's something that I don't want to say it got shut down. I think the readiness of that, we saw a best practice model in New York City. We know it exists in California and other states. But it's all about readiness and inclusivity, and so it has to be a community readiness.
Does that mean
we can't just
people-
bring something to a community if they're not ready?
What makes a community ready? You're always going to have politicians
Yeah.
that run for office,
Yeah,
trying to
yeah,
play on
yeah.
their fears. And
So for me, I'm not directly leading that effort. I have sat in meetings where these conversations have happened, and will continue to support as needed. For us at this juncture, is what's existing, what's in place, and then also ensuring that people have accessibility to Narcan kits, because we also know that can save a life.
And how are you doing that?
So we are distributing those across the community. We even offer trainings. We're not the only organization offering that. A lot of the harm reduction organizations are also making that readily available, because we know that there's a law called the Samaritan Law that protects a community member from saving a life. And so we want to make sure that individuals know that you can get access to them. They are also sold, obviously, at the pharmacies now. But if cost is a factor, we are also giving them out for free at no cost. And we want to make sure that everyone has access to Narcan. You know what I love about my mayor is that he walks around with one in his coat pocket.
Have you or he ever used it?
I have not. And I got to ask the mayor if he has. But he's ready. And that's what I care about. Because he's, as you know, he walks around the community, or he's jogging, or he's riding his bike. So it's nice to see that he really values lives and supports public health initiatives.
Do we have a sense of numbers of people, how many overdoses we have in New Haven specifically?
I don't have the data in front of me, but I definitely know that we are doing surveillance and monitoring that. When we see a spike in any of those circumstances, what we do is we activate and do a notification system and ensure that we're informing the harm reduction providers. And also, if it's significant enough, we will convene all of them and ensure that they're seeing where the hotspots are and where they should concentrate some of their efforts.
Nationally, fentanyl deaths have peaked and went down, right?
Mhm.
Are we seeing that here too?
Yeah, of course.
Why
And
is that about? Just it hit the saturation point?
I know. Yeah, it fluctuates. Honestly,
Narcan?
it really does fluctuate. We look at it by month and by hour, and so it does fluctuate on what month we are in, what day we're in, and so it's really fluid and static and not
And then
static.
I've been reading about nitazines, these from China, this chemical compound that's a lot stronger than fentanyl.
Mhm.
Have we seen any of that in our streets?
We're seeing a mix of things. There's the Yale Testing Center. We support that as well. And so they provide what we're seeing in the community. And once things get tested. And so we're closely monitoring that. And we will and do notify the public if we're seeing things different.
And we're talking to Maritza Bond, the city health director, finishing up her 6th year with plans for the next phase underway. You have a new, I guess, is it still, we're going to call it new. You have your own, you moved from Meadow Street, you have your own big center there on Chapel Street.
Yes.
Across the street from where the New Haven Independent print paper was in 1980s.
Look at that.
When it was a rundown building with like rock bands in the basement. And
near the museum?
Well, across the street.
Across the street from it.
441.
Yeah.
Directly across.
Yeah.
And your building used to be the plumbing supply place.
It was several things,
and
apparently.
An estate garage. And
it was also Board of Ed.
Why did you move there as like getting a big new headquarters of your own?
Right. So, we were on Meadow Street for many years. I inherited that space. And honored to have been in that space, by the way, because Dr. Quinn was my professor.
Right, Bill Quinn, yeah.
In my undergrad, and inspired me to go into public health, him and Peaches. And so if you're listening, Dr. Quinn, I admire you and thank you for your service. So I get to sit, and come full circle at his desk. And so it was truly an honor. But it was also not our own space. We did not own that space. And it was very dated. And so I had the opportunity to help move us to that new location. And now we own that space and it's city owned. And we are proud of that space. It was inclusive of the input from the community, from the staff, and making sure that because they spend a lot of time, and so we're 2 years. December will be 2 years.
And you have a wellness center there, right?
Yes, we have our wellness center.
What is the wellness center?
So our wellness center offers an array of services. We offer physicals and vaccines for children that are entering the school system. So we work very closely with the Board of Ed and compliance and making sure that they're ready and healthy to start school. But we also offer STI services
What are STI?
Sexually transmitted infectious diseases, and we test for all of them and support our community with that. We also provide COVID-19 and high-dose flu vaccine for our community members. As you know, that became a big debacle during this season, where the federal government was trying to restrict that.
So the government's trying to tell you not to take the vaccine if you're under 65.
Right.
Do you agree with that advice? And in either case, how are you stepping into that void?
We as a state and the commissioner took a stance early on, and we stand in solidarity with that. Public health should not be politicized. Someone's health or their well-being or desire to be vaccinated should not be limited. And so we are offering it to anyone who would like to be vaccinated. All of us across the city.
Do you think people should be vaccinated for COVID-19?
If you want to be vaccinated, you should be vaccinated. If you have if you're immune compromised, you should be vaccinated. We know the effectiveness of the vaccine. It saved many lives. When the vaccine did become available, it was controversial because it was a vaccine that was being created in the midst of a crisis, right? And so we were approving it under the emergency order, but now we are, here we are in 2025, and we know that individuals get lessened side effects from the vaccine, and so we want to make sure that if you want to be vaccinated, it's available. It should not be limited.
What's the advice? Like a few years ago, we were saying, as a government, as a society, it's a good idea to get vaccinated for COVID.
Absolutely. I think for us, and I say this repeatedly, it's if you want to be vaccinated, we're here for you. If you're uninsured or underinsured, we will offer that vaccine for free. And it's important for people to know that access is not a barrier.
Is there still an emergency order in effect? Or?
No, there isn't.
Because I always wonder how many vaccines to take. Because I believe in vaccines. I believe it's a good idea to take them. I thought the best thing Donald Trump did in his first term was the way he brought that to market. And although he doesn't like to admit that now, but I always wonder, like, how many do I have to get? So I got the shingles one because shingles supposed to be terrible, and I also read that when you're my age, a senior citizen, it actually helps prevent onset of dementia if you get a shingles vaccine. They did this study. But you don't get everything, right? Do you get Mpox? Do you get flu? I got the flu. Like, how many vaccines should a person take?
Well, it all depends on your needs. And I think it's important to make sure that you're connected to our primary care provider. Because when you're connected to our primary care provider and having a relationship with your primary care, you can then make those decisions together.
So are you more comfortable making opportunities available than telling people what to do?
Exactly. And I think for me, it's about individual choice. And prevention is key. And so if you want to prevent from because you're at risk, then for us, it's about accessibility and giving people the autonomy. People should have the autonomy to choose.
And we're talking Maritza Bond, health director. Before you became health director, right before you became health director, 8 million years ago, meaning before COVID, BC, you actually came in at a controversial moment because the city had a broken system for dealing with lead paint.
Oh, yeah.
So that was everyone was talking about nothing but lead paint with the health director. You came in, you were going to tackle paint, then you got the COVID.
Exactly.
You got the COVID crisis, but you were also working with lead paint. So what have you done in the 6 years about lead paint, and how's it working?
You know, that's actually a really good question. I mean, a good question because I was hired to tackle the lead problem. I had this whole vision, and then of course, the pandemic happened. But I had to simultaneously also deal
I
with the
remember
lead
you were
issue
chewing gum and you were walking. I remember. I remember there were
in
lead
my
paint
heels.
announcements.
In my heels.
But I do remember the lead paint announcements in the first couple of years.
Absolutely.
So what did you set up, and how's it working?
We worked really closely, and I love Pat King, my corp counsel. Her and I worked really closely together with legal aid and Amy Marks and Shelly and all of her team there, and worked really closely on ensuring that we dealt with the issue. And the fact of the matter is that there was just a backlog of documentation of entering into a system. So we had to build an infrastructure with technology. And so what we did internally is we lined up the city ordinance and the state statute, and we created a dashboard, which is available on the website. We're very transparent, and it's aggregated, so it protects any identifiable information, obviously. And we made sure that we tracked everything through the regulatory requirements, and also we're very transparent on what's happening. And so for us, we're battling. It's an ongoing battle. I mean, the fact is that over 80% of our housing stock in the city of New Haven was built before 1978. So it's an issue that is not going to go away, but it is preventable. So there's ways for us to be able to educate on how do you prevent it, especially for children under the age of 6, where the law applies to, because they're most development mental ages, right? And so it is a very serious poison, and so we want to make sure that we are working closely. We also have a lead task force that we just relaunched this past October, that are comprised of individuals with subject matter expertise, so that we can continue to look at this closely, because we want to make sure that we are thinking creatively and innovatively to be able to address
you set up more
this.
of an inspection. So you did first data and transparency. You set up this dashboard. People could see how many complaints there are and where the status is.
Exactly.
Didn't you also working with other agencies to have more inspections and then follow up in the courts when people weren't?
The inspection process, what we did is we just made sure we had capacity with lead inspectors, which we do.
So you hired more.
We continue. Yeah, we hired exactly what we need. And we do that through a combination of general funds and through our grant. So we have a lead grant that can also provide lead abatement to up to $15,000 for homes. And so if individuals have homes built before 1978 and they're renting to families, we're here and readily available to provide lead abatement services.
Okay, now, we talked before you came on that a lot of your work is done in conjunction with community.
Mm-hmm.
And you're talking about events you've come up with, maternal health and prostate cancer. What are those events?
Yeah, and so I just did, we're for the prostate cancer. One of the things that we did, and I'm supporting, and I'm just trying to make sure that I give the network, the group that's doing that work, some acknowledgement. So first, I'll start with the Black and the brown women's maternal health. We know that unfortunately, we still are seeing high infant mortality rates around Black and brown women, and so there is an initiative that's happening, and they're working on an event, the Voices of Maternal Health Project, on an event that's going to bring together women presidents and leaders across the community on December 3rd to have a conversation at the Community Action Agency, which we all know Amos Smith, and he's amazing. But Janelle Lawson is sort of leading us as a group to come together and have this conversation on December 3rd from 6:30 to 8:30 p.m. And so I'm supporting that. Have supported different webinars over the last few years on increasing awareness and the importance to getting that care. And then for the prostate cancer is also affecting men at a higher rate, especially Black men, 70% greater at a younger age, also at the age of 40. So I have supported and done PSA for the Prostate Health Education Network, and that's a national initiative. I think 28 cities are participating, and happy to report that the city of New Haven is supporting that effort.
All right. So Maritza Bond, it's been 6 years. It's been a longer career, lifelong career in public health. When you look in your first 6 years in this job, what has proved harder and what proved more doable than you anticipated? Like, what surprised you and what have you learned?
For me, responding to a pandemic did not give me the opportunity to really sort of reconnect with my community, where you meet with individuals, you build or reestablish relationships that you didn't have connection with, and I didn't have that. I had to respond to a crisis, and people had to trust me immediately. I had to tell employees that I did not know on how to delegate and be able to get them to respond to the pandemic, and then and it was a challenge, and it was a true challenge, but it also brought us together, and it centered around the issue, which was to think about the community that was being affected, and that I was full of gratitude. I mean, New Haven was a model across the country and even internationally. We had international interviews because we had one of the highest vaccination rates and response efforts across the country. And I was really proud of that, especially around the state of Connecticut.
I remember the tracking you were doing with the health
contact
students.
tracing and things of that nature. And then now I'm looking forward to
when did the job shift? When did it get to what you thought it was going to be, where you could be able to take a lot of initiatives, deal with a lot of issues at once? And
2023, I felt like we started shifting finally.
Really, all that time.
It took us a second to really get out of crisis mode. I saw it in 2022, obviously, but I feel like now this is a good momentum. We're going to be launching our strategic priorities to the public once we conclude with our community health assessment. And so I'm looking forward to what 2026 is going to bring.
And how long do you see yourself doing this job here?
As long as I can, I'm grateful to be in this space. I love New Haven. I'm glad to be back. I worked in every corner of the state of Connecticut in the last 20 years of my career, and now I'm back home.
And is there anything, are there any way your view of public health has evolved in the job? Something that surprised you, made you think differently about how most effectively to keep a community healthy?
It's important for us to kind of follow the public health emerging issues and be ready for the community's need and addressing the needs, because that's when you can't be comfortable ever in public health. You have to be able to stay in tune with what the community needs are.
All right. Well, Maritza Bond, it's always a pleasure to have you here.
Thank you.
You passed the checkup. I'm going to prescribe. I have a few prescriptions for you, which is Netflix, a little break from the job, and
I can Netflix and chill now. Thank you.
But nothing addictive.
It's such a pleasure.
And thanks, Harry Drost, behind the controls as always. We're going to take it out with the Afro-Semitic Experience performing I Wish I Knew How It Feel to Be Free.
Oh, I love that.
From the group CD, A Plea for Peace. This is Paul Bass inviting you to fly free with us all day and all night long at WNHH, New Haven's home for community radio.